If you're turning 65 or over 65, you know Medicare is extremely important to understand. But there's so many options. How do you figure it out? Well, by the end of this video, you're going to gain clarity, not only for your personal retirement plan, but you'll also have action items to secure your retirement.
To learn more about securing your retirement and all the different elements you need to know, subscribe to our channel and hit the bell to be notified when we post a video every Monday. We have helped hundreds of our clients gain clarity and get on the path to a comfortable and happy retirement. Now it's your turn. Let's dive in.
Welcome, everyone, to our podcast. And this week, we have a very special guest. Our goal is, and every one of our podcasts is to bring something of value in one of three areas. One is financial, the other is legacy, and then lifestyle. Today is something that can affect us in a lot of different ways. It might hit on a couple different topics, but it's on this idea of being able to navigate and understand Medicare. And I'm going to tell you, it's not that easy. I've worked around this for over 20 years, and I still get confused by all the different plans. So we wanted to bring on an expert, and we got a guy who I think is going to help us a lot. His name is Roderick Spann. So Roderick, thank you so much for coming on and talking with us and sharing all of the good information you're going to share with us today.
Thanks so much for having me. I appreciate the invitation.
Well, good. So here's the theme. The theme is the five biggest mistakes made by most Medicare beneficiaries. So Medicare is something that we get at 65. We get put on Medicare. It's not really like a thing that, we wouldn't do. But then there's other things that are left over after that. And there's things that we opt in for. There's things that we don't opt in for. So what we're going to do is we're going to hit these five issues, these five things. And Roderick, we just want you to kind of help us through. So one is this idea of enrolling in Part B. And in the way that I read this, that with the information that we've got here, is that it's something that you have to enroll into. So it could be a mistake not enrolling into it. So can you kind of give us what this is and help us to understand it?
Yeah. So with Medicare, there's what's called an initial enrollment period. And that basically revolves around a person's 65th birthday. So it includes the 3 months before you turn 65, the month you turn 65, and then 3 months after. Enrolling, generally, a person's going to enroll the 3 months before they turn 65. The reason for that is because when they do that, their Medicare will actually start the first of the month that they turn 65. If they wait to any time period after that, there's delays and there's possibly penalties for the late start of their Part B. That's probably one of the biggest things we see. Secondly, if a person is actually working, if they have creditable health coverage through their job, they actually don't need to enroll in Part B. It's a choice that they would have. If their employer has more than 20 employees, then they'd be able to stay on the group plan and they would be able to delay their enrollment in Part B. But if their employer is actually a small group plan, less than 20 employees, then they would actually need to enroll in Part B since Medicare will be primary. That's another mistake, a bit of confusion on the part of Medicare beneficiaries, not exactly knowing when it's actually required and when they should actually do it, the timing of it.
Give us what is a quick description of what Part B is, just for anyone that maybe at 55, 60 hasn't really done a lot as far as the research into Medicare. What does the Part B actually provide for them?
Okay, yeah, excellent question. Part B is actually a medical insurance. So it's everything that takes place outside of the hospital. Part A of Medicare covers everything, if you're admitted into the hospital, room and board, skilled nursing care. So Part B covers your doctor's visits, any outpatient surgery, expensive things like CAT scans, MRIs, chemotherapy, kidney dialysis. Part B really is that specific part of your medical care.
Yeah, so it's kind of like the insurance that we're already used to having while we're working is essentially what Part B is. So very important. You want to make sure you do that on a timely manner and think through Part B and the time that you should be enrolling. And also that 3 month window, I've heard you kind of want to start right at the beginning of the 3 months, just because, there are backlogs and you want to get in and you want to make sure it starts on your 65th birthday. So I think that's a good point there too. The second mistake here that we want to talk about is now this is going into a different part D. which D, easy way to remember that is D is for drug and drug coverage and prescription. So take us through that as far as how someone needs to make that decision around Part D.
So what we generally see with these Part D prescription plans is, oftentimes a person, if they're not working with an advisor or someone who kind of understands how these plans work, they may just pick a plan based on name recognition, or perhaps it's what one of their friends or family members have. But these Part D prescription plans are all very different. There's about 25 to 30 Part D prescription plans available in each state. They all have different formularies, different copays, different premiums, and there's no one size fits all when it comes to Part D. It's very specific to a person's list of medications. So if a person doesn't analyze their prescription drug coverage, they could be paying way more than they need to. Not just by being in the wrong plan, but secondly, by not going to the right pharmacy. Almost all of these plans also have a preferred pharmacy that you'll get the best rate. If you go to the wrong pharmacy, you literally could be paying thousands of dollars more than you need to. And so this analyzation of a person's prescription drug coverage is something that we recommend for all of our clients. It's something that we do every single year during that annual election period from October 15th through December 7th. And then any changes that take place then will go into effect the first of the following year. So that's an extremely important aspect of a person's Medicare coverage.
Now, is this something too that you're kind of doing if you're turning 65 or whatever, that you would want to kind of figure all this out that 3 months prior? That's kind of the thing. So you have all of it ready to go?
Yeah, 1,000%. So the same initial enrollment period for Part B applies to Part D of Medicare as well. So you can take a look at your coverage 3 months before. That's when we recommend 3 months before, so that your Part B and your Part D prescription drug coverage goes into effect the first of the month that you turn 65.
Okay, great. So now we're going to move on to this other part. And to me, this part, this next mistake or this next thing of trying to understand, again, just adds to me another layer of complication. You've got this Medicare, right? You got Part B, Part D, Part A, and then there's still a gap that a person would have to pay on their own outside of their deductible, or as a part of their deductibles. And so now what a person does is say, now I want to go buy this plan that's going to help me with all these things. And you can get a Medicare supplement, or you can do this thing called Medicare Advantage. So I guess we got to analyze this. Can you kind of help us to think it through? What is the difference between the two, I guess, and what's the issue?
Yeah. So that's the topic of Medicare supplements or Medigap plans, as they may be referred to at times. And the difference between them and Medicare Advantage plans is something we discuss often. How original Medicare works, just backtracking a bit, we have original Medicare, which is Part A and B. In a very general sense, original Medicare only covers 80% of your medically necessary services. So if you only had Parts A and B of Medicare, you would be responsible for 20% of an unlimited amount. Now, what some people would do is they'll go and they'll shop for a Medicare supplement or a Medigap plan that actually does exactly what its name implies. It fills the gaps that original Medicare does not. It supplements your original Medicare by helping to pay that extra 20%. So they work in connection with each other. A Medicare Advantage plan is totally different. Even though you still are responsible for paying your premium to the government for original Medicare, a Medicare Advantage plan actually takes you off of original Medicare and puts you into a fully privatized insurance policy, more like what you're used to through your employer, like an HMO, a PPO, a point of service kind of plan. And some of the biggest differences between those two routes, a supplement and an Advantage plan, is really cost as well as choice of doctors. With the original Medicare and a supplement, you're able to go to any provider, any hospital in the United States and its territories that participates with Medicare. So right now, that's about 99% of hospitals and over 90% of providers. With a Medicare Advantage plan, again, it's like an HMO or a PPO. So it's highly regionalized, it's localized to your specific area, where you have to go to the doctors and hospitals that are in that network. Even if you have a type of plan that allows you to go outside of network, there's still rules and stipulations that must be followed. So there are two different ways to get your Medicare coverage. A supplement works along with original Medicare, which still gives you that freedom. And then an Advantage plan replaces your original Medicare. But sometimes they'll throw in some additional benefits like rides to the doctor, some dental, some vision, and other things that could be a benefit to you.
So it looks like a recurring theme here in all these mistakes is really, you got to know what is going to work best for you. You got to understand your own situation before you can really go out and start shopping, because all these plans have different little nuances to them, and different parts that, may or may not apply to you, and that can affect how much you're paying, can affect how much coverage you're going to get. And so that kind of leads me into the next one here is, all right, let's say we have a scenario of someone that actually has retiree coverage, or they are still working and covered by an employer plan, and they just assume that means that they don't need any of this Medicare stuff. They don't need any of these other parts that are available to them once they turn 65. Why is that a mistake to make, and assume that everything is good with the current thing that they have?
Yeah, I think you're correct there in the sense of just analyzing your coverage is the most important part. Specifically for this aspect of retiree coverage, not every retiree package is going to be that great. The coverage may not be that great. The cost that you may have to pay may not be the most cost effective. Some of these retiree plans, it's a $0 premium and you get great coverage. So obviously you would probably want to stick with that plan. But now more than often we're seeing with some of these retiree packages, there's a monthly premium that's involved. There's large co-pays and maximum out-of-pockets that when compared to original Medicare or a Medicare Advantage plan, it just seems that the Medicare route may be more cost effective. So just assuming that your retiree package is the best one for you may not be the best decision. Being able to understand what your cost and coverage would be, and then comparing that to what Medicare and a supplement or a Medicare Advantage plan may offer would be to your best benefit, because oftentimes they don't balance each other out.
Great. So that's going to take us now to our last of the five here. And this one's kind of funny to me because we jokingly say that because, we deal with investing and we deal with people's retirement plans. And basically, a lot of times people say, oh, you ought to buy this stock. And like, what'd you base that on? Well, my neighbor has it. And it's like, okay, well, what kind of analysis is that? I don't know, but we talked about it and we think this is a cool stock. And so this last one is, you basically are saying it's a mistake to select a plan based on maybe what a family member has or a friend has, and that being your decision-making. So tell us what can go wrong there.
Yeah. Well, just like you said in your example, almost everything can go wrong. Unfortunately, we love our friends, right? We love our family. But they may not be the most experienced, or they may not have the best insight when it comes to your Medicare choices. As we mentioned at the beginning, Medicare is not one size fits all. A prescription plan that works for one person in one state or one specific zip code may not work for another person in a different state, different zip code, different age, different gender. All of these things are taken into account. So even though we love our friends, we love our family, it's probably best to speak to someone who's a professional in the area that can give you, unbiased advice that's really tailored to your specific situation.
Great. I got one quick question, and do you have a question too? You can go ahead. I don't want to go out of turn.
No, I was going to kind of sum up a little bit, but I look at it from the perspective of, let's say we have all these decisions that we have to make in life, whether it's buying a car or buying a house, or choosing the right financial advisor for you. There's all this due diligence that we need to be doing the research. What types of bells and whistles do I want on the car? What types of amenities do I want in this house that I'm going to buy, and do the research on it. What type of advisor do I want to be working with? Are they active? Are they more retirement based? And so on the same token, I think Medicare should not get neglected. While it is very complicated and it can be a little intimidating, There's a lot of things here that could cost you if you don't do the right research and you don't look around for things that are going to specifically apply to you. That's why I think that the power of this message here and the story is so good. So I just want to say thanks for hopping on and giving us some insight here.
Yeah, and I've got a quick question for you that I wanted to ask is, somebody's looking at this thing, say they're 64, they're getting close to 65. Could you kind of walk us through, like, if somebody did reach out to you, what that would look like? And let's say that they're trying to figure this thing out, so they can say, hey, instead of me trying to do it myself, I'm going to reach out to another person who is an expert in this field. Could you kind of walk us through what that would look like if they did that? Like, what would that conversation be like?
Yeah. Well, basically, most conversations should take much less than an hour. But basically, just we'll get an understanding of where you are. One, if you're looking to retire, if you're going to continue working past the age of 65, is your current insurance covering just yourself? Is it covering your spouse? Is it covering any other family members? Kind of getting a better idea of your whole health insurance picture. And then based on that information, we'll be able to quickly run you some quotes, give you a couple scenarios, different routes that you'd be able to go. And then basically after that, there's one small section that is your responsibility. And then we actually are able to assist with the enrollment in the rest of your Medicare plan. So not only do we educate, but we also assist with the enrollment of these specific Medicare plans. So it's a pretty short and sweet kind of conversation, pretty straightforward.
Great. So if somebody is thinking, hey, I need to get help with this, what's the best way for them to reach out to you and get more information?
They can just give me a call directly, 908-481-5678. Or they can send me an email at roderick@senioradvisors.com. We're trying to always stay available. So if you send me an email or you give us a call and you leave a message, we'll get back to you as quickly as possible.
All right. So if you're listening to this and you just heard him give you that email and that phone number, don't worry. You don't have to look very far. It's right on the website, or it's in the show notes, wherever you're listening to the podcast. Roger, we do again. Thank you so much for taking some time out of your day and sharing it here and giving us such good things to think about when it comes to Medicare.
Awesome. Thank you guys so much. I appreciate it.
We hope this video has given you some confidence and clarity as you plan for a worry-free life in retirement. But what else do you need? We have created a complimentary video course called 3 Keys to Secure Your Retirement. This video walks you through step by step what you need to do to get ready for retirement. You can also check out our podcast called Secure Your Retirement. You can subscribe below.
For more retirement tips, watch this video. Create your retirement income plan. Also, click here to subscribe to our podcast, Secure Your Retirement. If you like this video, hit the like button and be sure to subscribe and share it with your friends.